What does high cholesterol mean? An excess of lipids, or fats, in the blood is known as high cholesterol. Hyperlipidemia or hypercholesterolemia are other names for it. To function, your body needs just the proper amount of lipids. Your body cannot utilize all the fats if you have an excess of them. Your arteries begin to fill with more fat. They produce plaque, fatty deposits, in your blood when they interact with other chemicals. For years, this plaque may not create any issues, but it gradually grows more and larger inside your arteries. This explains why it's risky to have high cholesterol untreated. Unbeknownst to you, the excess lipids in your blood contribute to the plaque's growth. The only method of knowing if you have a blood test for elevated cholesterol. Lipid panel, a blood test that measures the amount of lipids in your blood, provides this information. Based on your age, gender, and past history of heart disease, your cholesterol level may be deemed high. Good and poor cholesterol in comparison. Lipids are classified into various categories. Most likely, you've heard of good cholesterol and bad cholesterol as the two basic types. High-density lipoprotein is the term for good cholesterol, HDL. Consider the letter H to stand for helpful. Your liver receives cholesterol from your HDLs. Your liver maintains a healthy balance of cholesterol. It produces just enough cholesterol to meet your body's requirements and eliminates the excess. HDLs are necessary to transport cholesterol to the liver. Your HDLs will be too low if they are excessive levels of cholesterol in the blood. Low-density lipoprotein is the term for bad cholesterol, LDL. This is the one causing the buildup of plaque in your arteries. Over time, heart disease may result from excessive LDL cholesterol. When to have a cholesterol test? Childhood or adolescence can be the onset of high cholesterol. Current standards recommend starting screenings in childhood because of this. Kids and teenagers, beginning at age 9, have your cholesterol evaluated every 5 years. A youngster may start even earlier if their parents have a history of cardiac issues or excessive cholesterol. Those categorized as male at birth, AMAB, up until the age of 45, have your cholesterol examined every 5 years. Get checked every 1 to 2 years from the age of 45 to 65. Once you're over 65, be checked annually. Female at birth assigned individuals, AFAB, up until the age of 55, get checked every 5 years. Get checked every 1 to 2 years from the age of 55 to 65. Once you're over 65, be checked annually. These are only broad recommendations. What's best for you will be discussed with your healthcare practitioner. For instance, a person in their 20s with elevated cholesterol may require annual testing for a time. Individuals with additional heart disease risk factors might also require more frequent testing. Reasons for elevated cholesterol levels. Genetics and lifestyle choices can contribute to elevated cholesterol. Factors related to lifestyle include tobacco usage and smoking. Smoking increases your bad cholesterol, LDL, and lowers your good cholesterol, HDL. Being extremely stressed out. Hormonal changes brought on by stress lead your body to degenerate cholesterol. Alcohol consumption. Consuming too much alcohol might cause an increase in total cholesterol. Not moving around enough. Aerobic exercise or physical activity lowers cholesterol levels. You won't have enough good cholesterol in your body if you work a desk job or spend a lot of time sitting down. Diet. Your cholesterol may be raised or lowered by certain foods. Healthcare professionals occasionally advise making dietary adjustments or scheduling a consultation with a nutritionist to go over your diet. Signs and symptoms of elevated cholesterol. Most persons with high cholesterol don't have any symptoms. It is possible to run a marathon and have elevated cholesterol levels. It will take additional health issues brought on by your high cholesterol before you experience any symptoms. An example of a condition linked to elevated cholesterol. Your risk of peripheral artery disease, high blood pressure, and stroke increases if you have high cholesterol. Diabetes patients often have high cholesterol. How does my body react to elevated cholesterol? High cholesterol causes plaque to accumulate inside your blood vessels over time. The accumulation of plaque is known as atherosclerosis. Individuals who have atherosclerosis are more susceptible to a wide range of illnesses. This is due to the vital functions that your blood arteries perform throughout your body. Hence, there are consequences when an issue arises with one of your blood vessels. Your body's blood arteries can be compared to an intricate system of pipes that maintain blood flow. Plaque is similar to the crud that clogs your home's pipes and slows down the drain from your shower. Your blood vessels' inner walls get coated with plaque, which restricts the amount of blood that may pass through. Your blood arteries will develop plaque if your cholesterol is high. The plaque gets larger the longer you don't get therapy. You experience narrowing or blockage of your blood arteries as the plaque grows. You may have prolonged blood vessel function, similar to a partially clogged drain. However, they won't function as well as they ought to. Which blood arteries become clogged depends on which medical disorders are associated with high cholesterol.